we are super excited to have two new doctors. So I'll kind of ask the same question of Dr. Wolf, if you could just tell us a little bit about how you got here.
Sure. So I guess my love of science and learning kind of drove me into the field of medicine. My mom always joked that if I could be a professional like student or learner, that would probably be where, where I would be. Unfortunately, school costs money. You can't stay in school forever. So medicine just kind of brought me to this, it's the ability to connect with people, but also this never ending learning. In medicine, you have to just stay on top of every new thing. There's new things every day. So my love of learning, my love of people and science and everything else just kind of merged. And that's kind of almost the same thing that brought me into, deciding to go into family medicine. Was as I was going through my medical school rotations, every single rotation I was on, I loved, with the exception of maybe standing in the OR for hours at a time. But I was like, oh, there are things about everything that I truly enjoyed. And so, family medicine really is what allowed me to do the most. And so I did a scholarship through the military, which is kind of my last 7 years have been military medicine, getting to do my residency in Hawaii and then practicing for the last 4 years in Colorado, where I really saw a wide breadth of, pediatric, adults, geriatrics, the whole mix. And it was great. But military medicine, much like, our medicine here, is those 15-20 minute, appointments, 20 to 30 patients a day. And when I saw, I had talked to people in direct primary care and different practices, and I really thought, hey, this is the way medicine should be. And then I just happened, when we decided to move back to Pittsburgh, came across Connected Health. And after, kind of stalking the webpage a little bit and sending emails to Andy and Betty, I decided I can't imagine myself anywhere else. This is, again, what medicine really should be, that, you get to take time with your patient. You get to investigate things, not just, oh, we're going to send you to this specialist, follow up in 6 months. Here's your pill. Have a good day. So it's, I think it's what medicine is supposed to be, and the ability to do, home visits and just really get to know patients is truly amazing.